Welcome back. We are sitting in right now as health leaders join for that Huntsville's COVID-19 briefing.
Yeah, they're talking about some of the issues at hospitals. Let's go ahead and listen into what they're saying.
Huntsville-area government, healthcare, and emergency response agencies, we bring you this briefing on our community's response to COVID-19. Our speakers today will be Mr. Jeff Sams, CEO, Huntsville Hospital, and Dr. Rick Kohler, ER physician, Crestwood Medical Center. Before we go to our first speaker, I'll go over the current numbers. In the state of Alabama, there have been 932,250 confirmed cases of COVID-19. In Madison County, 60,408, having resulted in 755 confirmed deaths. Current positivity rate for Madison County is 36.7%. At this point, we'll go to our first speaker, Mr. Jeff Sams, Huntsville Hospital.
Thanks, Jeff. I'll start with our numbers. In the Madison County, the hospitals we operate have 116 COVID-positive inpatients. 18 of those are in the ICU, and 9 are on a ventilator. In our health system today, we got 223 COVID inpatients, 43 in the ICU, and 15 on a ventilator. The number of cases of COVID in the community has just skyrocketed, and clearly Omicron appears less likely to cause hospitalization, but there are so many cases. We are continuing to see the hospital census rise rapidly, and the patients that are in the hospital are very sick. The majority of our COVID inpatients are unvaccinated. We only have one patient in the hospital with COVID who's had a booster vaccine who is in the ICU. I think that's important that our local experience is consistent with what you see on the national news. Vaccination is helping prevent severe disease. Even if there are a number of breakthrough infections, it is doing its job of preventing severe disease, and a booster shot appears very necessary against the Omicron variant. In the past 3 days at Huntsville Hospital, we had 5 deaths due to COVID. The positivity rate of tests is at an all-time high. It's been about 31% for us, and we are hearing that of the typing of our cases, approximately 80% right now are the Omicron variant, so that's clearly become the dominant strain. Emergency departments across the country are extremely busy, and we are no exception. All the ERs in our system are busy managing COVID, and they're also now managing the normal wide variety of illness and trauma. These may have been the busiest few days in the history of our emergency department. Nearly all our staff beds are full, and at any given time in our health system, we're holding 50 to 100 patients for admission in our ERs, and it puts a tremendous strain on those resources. This past week, we stopped doing inpatient elective surgery at the Madison County hospitals to free up beds and resources. So we do have a request that people do not come to the emergency department for routine testing or minor illness. Contact your primary care physician's office, use urgent care or walk-in clinics, use our fever and flu clinic on Governor's Drive, or if you're just having minor symptoms, just stay home. Use the ER only for true emergencies. It's important for us and important for EMS. EMS has been extremely busy, and we need to preserve the resources and emergency response resources in our community for patients who truly need them. So again, if you're feeling mildly ill, the ER is not the place to go right now. We need to save those resources and work together to maintain emergency response in our community. Another thing that's impacting us is staffing. While most of our staff are vaccinated, and if they get COVID, they experience mild symptoms, but the quarantine and isolation protocols are in place, has nearly 500 staff across our health system who are unable to work right now, further straining the resources. We're so thankful for those dedicated staff. I just want to take a minute to thank them. Physicians, nurses, EMS staff, respiratory therapists, pharmacists, housekeeping, food services, registration clerks, security guards. I could go on. These amazing people have managed COVID patients on a daily basis for 2 years. I wish everyone in the community could witness the dedication and commitment these people have to taking care of their neighbors. So please be nice to these people. If you have friends who are healthcare workers and have been in the trenches, please thank them for stepping up again, and again to take care of their friends and neighbors. Just a few reminders, if I can turn my page. Masks are a very effective tool. Any mask is better than nothing, but we encourage double layer masks, surgical masks, or N95s. Omicron is so contagious, you're better off stepping up your mask game a little bit. Vaccination remains the least expensive, most effective tool to keep you safe. A booster shot is extremely important with the Omicron variant. And at our clinic on John Hunt Park, we're open 4 days a week, and you can schedule through our website. We'll all get through this together. Hopefully, Omicron will come and go very, very quickly. The next few weeks are going to be extremely challenging. Thank you.
Thank you, Jeff. And now we'll go to Dr. Rick Kohler from Crestwood Medical Center.
Thank you, sir. Omicron, what do we know? Preliminary reports from South Africa and the United Kingdom, it's twice as contagious as Delta. It's rapidly become our primary variant, and as Mr. Sams has alluded to, we're at 95 to 100%, according to the CDC, at least in our region. It evades natural immunity. So if you've had COVID recently, you can get this variant again as after having the first variant. The solution to that is vaccination. That's going to be really our only known and proven therapy and way of trying preventing this from happening, not therapy, but prevention. By doing so, in being fully vaccinated, the boosted vaccinated patients seem to have the highest degree of protection. So that's what we want to try and move towards. So what are we seeing? As again, Mr. Sams alluded to, we have seen surging numbers. Most of what we've seen has been a flu-like illness, with a smaller percentage of those people requiring admission. Those who have been admitted predominantly are the unvaccinated. So again, go get your vaccines or get started on your vaccines. Despite some early reports that the illness was less severe than Delta, given the vast numbers and the infectivity rate that we're seeing, it's very easy for this to overwhelm our healthcare systems. And as you've already heard, we are all working at extraordinarily strained numbers. With a 20% loss of healthcare providers in the last 2 years, since February of 2020, we don't have the nursing resources, we don't have the EMTs, we don't have those people who support us to try and take care of you and your families. And so it's really important to help us and to help yourselves and your family members by getting vaccinated, wearing masks, doing the things you can do to protect yourself from becoming infected or spreading it to those who are the most vulnerable, and then keep the ERs clear and open and available to take care of those who are having heart attacks, who are having strokes, who have broken bones, who've been through major trauma, who we're having challenges trying to get to them and take care of them in a timely fashion. What else can we do? Be healthy. You've heard a lot about vaccines and masks. And it's correct, the N95 is going to be the best, and those are more readily available now than they were at the beginning of the pandemic. K95, surgical masks, the next two choices, and then cloth masks. And as the CDC's recommended, you probably need to step up your game. A single cloth mask is probably not going to be protective against this variant. So double cloth or double mask if you can. But be healthy. Take your medications. We see an increasing number of people who, because they're afraid to go out, ran out of their medications and now are having exacerbations of their underlying chronic illnesses, and we can't get to them because the rooms and the waiting rooms and the rooms in the hospital are full, and we don't have nursing staff to care for them. So, do the best you can on all your preventative care and all your preventative health issues so that you can avoid having to be a patient of ours in the emergency department. I would like to emphasize that the ERs are not testing centers. If you have mild illness, and that's what we've predominantly seen so far, please use those testing centers. They're available in the community. If you don't know where those are located, reach out to either Huntsville Hospital or Crestwood's emergency hotlines and ask, hey, where's the closest testing center, so that you're not clogging up the emergency room for those who have more severe illness or other comorbid conditions that require emergency care. I think that covers most things I wanted to say, and I'll be ready to open it up for anyone who has any questions.
Thank you, Dr. Kohler. And thank you for watching today. Our next scheduled briefing is Wednesday, January 19th at noon. Until then, critical updates will be posted to the City of Huntsville's COVID-19 webpage, as well as the websites of our other partners here today. Until then, stay safe, stay separate, and remember to sanitize. At this point, we'll take questions. As always, as you come to the mic, please identify yourself and who you're affiliated with, and we'll allow one question and a follow-up.
Good afternoon. I'm Dallas Parker from News 19. This first question is for whichever of you want to answer it, honestly. The variant, of course, moving at super speed, skyrocketing cases, percent positivity rate going up each day. But based on previous trends we've seen with surges, when should we expect things to slow down?
I'm speculating. I don't think we're at the peak yet. The models we look at suggest a mid-January peak. If I had a crystal ball, I wish I did. So I think the models we have seen and we track in the hospital suggest we're a week or two away from the peak in number of cases. Hospitalizations will lag behind that because it takes a little while to get sick enough to be in the hospital. But again, I'm guessing a bit as to when the peak might be.
Yeah, I would just add to that that seems to be, at least through the references, the sources I've seen through ACEP, American College of Emergency Physicians, although it's regionally different based on when they first started to see their surges, that seems to be pretty much what they're thought, but based on the preliminary data, again, the stuff that's not fully in from South Africa and from the United Kingdom in their experience, since they're a few weeks to months ahead of us on this.
Gotcha. My follow-up is for Dr. Kohler and Mr. Sams. Being that staffing is already impacted at your hospitals and facilities, when effective treatment, mostly speaking about monoclonal antibodies, become available, what's your plan to administer that? That treatment takes quite a bit of time.
The challenge right now is the effective therapies against the Omicron variant are in very scarce supply, so we have a very, very limited supply of the one effective monoclonal therapy, and we try to hold on to that for patients who are most at risk. And the antiviral pills just haven't made it out to the market yet. So when those drugs are available, we will go back to trying to identify everybody at risk. And I think the pill is likely to be an extremely convenient way for people to get treatment. So we're getting as much as we can, and we'll go back to doing the infusions at our flu and fever clinic, and then hopefully over the next few months, and I don't know how long it will take, the Pfizer and the Merck antiviral pills will get into the local pharmacies.
That's the plan. As it's an extremely scarce resource right now. The most recent monoclonal, where we used to have multiple different choices, we no longer have those, and that's being kind of strictly allotted by the government at this time. And so as we get those, we'll try and get those out. We'll identify those who are at higher risk and make sure that they're the first ones to receive those therapies, and then we'll work our way down. Whereas before, you and I believe, had a conversation that we were trying to get that to as many people as we could. Unfortunately, with this variant, we're down to one option, and until these oral agents come available and we sort through the myriad of potential side effects with the oral agents, their safety and how to use them most appropriately, we're going to be challenged for a brief time.
Nolan Crane from WAFF 48 News. My questions today are with regards to schools. A lot of schools either opened up yesterday or today, back from the holiday break. A lot of school districts are requiring the masks, but we just found out from you guys today that maybe one mask simply isn't enough. What do we want the parents at home to know? Because so many kids are still in the classrooms. They try to social distance, but it's kind of inevitable. Are we worried about another spike kind of because of the masks?
I'll take a shot at that. One, we think masks are very effective, and with the Omicron variant, wearing a high-quality mask is extremely important. I will not try to put my place in the place of a school board that was elected to make these honest decisions. I think these folks deserve our support as they grapple with trying to balance the needs of kids being in school, the low risk of severe disease amongst a child, with the very real risk of not passing it to each other. So we fully support masks, and we also fully support the school boards that are having to make some really hard decisions and want to support as they grapple with these difficult questions. But with the masks, I personally think it's a minor inconvenience to put on a mask, and I don't mind wearing it at any time. And if I'm going to wear one, I want to wear a good one.
Perfect. And then my last question, several school districts also said they're going to be monitoring the Alabama Department of Public Health's data and numbers when it comes to specific counties. For example, Huntsville City Schools, they're going to look at the numbers for Madison County as a whole to determine, do we keep masks required or do we make it optional? We expect a peak for Omicron and COVID to be mid-January. Nobody has a crystal ball, but do we envision those numbers dropping anytime soon, getting out of the high to severe case numbers?
Yeah, again, I'm speculating a bit. I think there's going to be a lot of cases in January, and that's probably as far as I'll go with it.
I echo that, unfortunately.
Alex Lynch, Way 31. CDC guidance on quarantining, isolating. Can you put that into plain language?
As you probably already know, the recent change, I believe, was released this morning or yesterday, I think it came out. And to try and place it as simply, it is that if you currently are symptomatic and you tested positive, then after 5 days, if you're feeling better, given the most recent quarantine recommendation, and you have access to a home rapid test, take the home rapid test. If you still test positive, then they want you to quarantine for an additional 5 days.
Follow up. How do you feel about that? Do you have additional?
I don't. I wasn't part of that decision-making process. Thank goodness. And but if that's what they're finding is the best balance at this time, I will defer to those gentlemen and professionals. They're under a lot of pressure, and I would not want to be wearing their shoes or their hats. A lot of scrutiny, as you all know, through the different media sources and different communities. I think that we need to give those guys support because that's a really challenging job to try and balance what's best from a health perspective as well as what's available and what's best to try and keep us working and moving forward as a country.
At this point, we'll end the press conference. Thank you for coming.